I'm your host, Rihanna Ramsey, and today we have the National Coordinator for Adolescent Health attached to the Ministry of Health, Ms. Silandel Glenn, and she will be sharing more with us about her department and the work that she does specifically as it relates to the health and well-being of our young people. Welcome to the program, Ms. Glenn.
Thank you very much, Ms. Ramsey, for having me. It's a pleasure being here.
Okay, so just before we head into our program, we usually give our guests, especially those who are gracing us for the first time, a chance to tell our viewers a little more about themselves, academically and otherwise. So we'll give you that opportunity, and then we'll go into our discussion.
All right, no problem. So as you would have mentioned, my name is Silandel Glenn, and I'm currently the Adolescent Health Coordinator attached to the Adolescent Health Department, Ministry of Health.
Yes.
I've been working in this area with adolescents and young people for quite some time. My journey started at Artist in Direct Support, and then I would have transitioned into the government, the public sector rather,
Yes.
in 2011. So I'm in adolescent health and working with young people for quite some time. My academic background, I have a diploma in public management as well as a diploma in social work and a degree in social work. And just recently in 2018, I was one of the recipient of the Chevening Scholarship. So I would have traveled to the UK. I'd spent 1 year and I completed my master's in child and adolescent mental health. In addition to that, I'm currently pursuing a master's in social work at the University of Ghana, where I'm expected to graduate come November.
Okay, so you have quite a resume there,
Yes.
and we started a bit late for those who usually join us here on the radio. We usually start at 1, and sometimes our guests, depending on how busy they are, some of them are doctors and they're out in the field. And Ms. Glenn, she came all the way from Latin, straight off a flight from Latin, and straight into the studio. So we must commend you for giving us coming straight here and for all the work you've been doing over the years with our young people. So we're talking today about adolescent health, and for those who don't know what that is, can you just break it down? What does it mean? What is the definition for adolescent health? What does that mean really? What are we dealing with?
All right, so when we talk about adolescent health, it's basically we're talking about health and the well-being of our young people. We're talking about the aspects of prevention, detection. But I want to say early detection, not just detection, but early detection and treatment of health issues and complications that would affect persons between the ages of 10 to 19. Because when we talk about adolescents, we're talking about persons between that particular age group once you fall between age of 10 to 19. And sometimes we also look at, or we would say, adolescents and young adults, so we will take it up to age 24, right? So adolescent health is generally just looking at anything that relates to your well-being, as it relates to being healthy, and also we look at interventions or activities that address the various health issues that our young people face, or rather our adolescents face. So it's very that simple.
Okay. But it's quite broad topic because we have quite a number of young people, and everybody has to go through that stage.
Correct.
In terms of starting adolescence, at what age or how early does a person start to go through that process, that change?
Okay. That's at age 10. So adolescence usually starts at the period of age 10 and it lasts up to age 19. So most of the cases when persons start puberty, sometimes you will find that some persons will start puberty at age 9, but give or take the highest age or the correct age, or you usually start at the age 10. So we can say that adolescence begin at that age 10, and then it lasts all the way up until age 19. When we talk about the adolescent period, we have 3 different stages, right? We have the early adolescence, we have the middle adolescence, and we have the late adolescence. So you go through puberty around age 9, which marks the beginning of your transition from childhood to adulthood, and it marks that beginning period of your adolescent years.
Okay. And what do you recommend as a health worker? How do you recommend a child or usually teenager or whoever it is that is going through those sudden hormonal changes, how do you recommend that they deal with those changes in their bodies? And like, sometimes it affects the way they think. I know, for instance, I know a child who's going through a change, and she's going through the change early. She's 9, and she has a sister who is about 6 or 7, and one day she wants to play, and another day she doesn't want to play. What do you recommend for those going through that?
That's a very good question. You see, the period of childhood or period of adolescence in this case is very unique, I would say. I know most of the time persons will think or say adolescents are very difficult to deal with, but adolescents are not difficult to deal with. Once we, as adults, once we educate our adolescents, because adolescents don't always know everything likewise as adults. So in order for them to deal with whatever changes they're going through, and they go through several changes like you would have mentioned, they have those physical changes, the emotional changes, the psychological changes. So in order for them to effectively deal with that, in order for them to cope, we need to educate them. Right? I know that there is a lot of misconceptions that parents think that we should not talk to our child or adolescents about certain things, but if we don't talk with them, we cannot prepare them. So preparation is important. Once we give them the information when it comes to puberty, when it comes to reproductive health, when it comes to the changes that their bodies will go through when they're going through that adolescent stage, they will be prepared. They will be better able to manage and cope what they're going through. For adolescents that are listening to the program right now, if you know that you're going through that stage of puberty and you're seeing those changes, educate yourself. Find different coping strategies. And coping strategies could mean things like physical activity. It could mean participating in something that you love, whether it's gardening, whether it's art therapy, whether it's music. These are things to help you deal with what you're going through. But the most important thing is learning, getting the information, see what are the changes that you will go through at this particular time period, and know what changes you will go through. Not everybody will go through the same changes. Everybody might not have the pubic hair at the same time. Everybody might not have that body odor. Everybody might not have that symptoms of withdrawal as you explained based on the person that you know. Some persons might be extremely hyperactive. So know what are the changes that you're going through and then find solutions to best help you. There is no one size or one cap fit all when it comes to the changes that we go through. But through education and awareness, we will know how to cope.
So we recognize a person is going through it by physical changes, but sometimes, let's say the physical change hasn't kicked in as yet. What about how do parents or guardians, how do you recommend that they deal with helping that child transition once they recognize that, okay, the person is starting to think more maturely, they're starting to go into that stage? How do you recommend that they coach their children through that period successfully?
So it will come back. I like to talk about education, right? Not because I have this big academic background, but I believe that through education, through awareness, we create the behavior change that we want. More so the behavior change when it comes to healthy lifestyle, when it comes to well-being. So as parents, you also have to educate yourselves about these different changes that your child or your adolescents would be going through, right? So I literally advise parents, reach out to your healthcare workers, reach out to your health centers, reach out to guidance and counselors or social workers, and they will be able to give you the information. So once you prepare yourself, the next thing that you will be able to do is effectively communicate or talk with your child, because talking and communication is important. We can't see behavior change. With education, we have to be able to communicate and effectively get that message across. So as parents, once you prepare yourself, you sit down, you have an open and adolescent or youth-friendly conversation with your child, with your adolescent. We need to, I'm not a parent, but parents need to shy away from that platform or that notion that I can't discuss certain things with my child. I can't sit and talk about reproductive health. I can't sit and talk about puberty, about sex, about condom use, about emotions, about talking to a boy, about talking to a girl. We have to sit down and have that channel, make that channel of communication open, because you know what your child is going through. So who's best to talk with your child but yourself? Exactly. The other thing I like to tell parents is be realistic. Right? We are living in a change in times. we have social media, we have different things that are influencing our young people. And if parents are not realistic, if they don't sit and say, well, this is what is happening in society, we have adolescent pregnancy, we have mental health issues that are affecting our young people, our adolescents are going through these changes. If they're not realistic, they will not be able to effectively communicate and to help their children cope or go through that period of adolescence, right? Adolescence, as I mentioned before, it is very unique. For adolescents themselves, it can be very challenging because most of the time they don't always understand everything that is happening around them, right? Talk to your children about their attitudes rather than screaming and lashing out at your child. Once you see that that child is behaving in a certain way, because one of the changes that will happen is their attitudes will change.
Yes.
Sometimes some children become more aggressive, and rather than you reacting with another aggressive man as a parent, you talk to this child. I understand that you're going through adolescence, this period. I understand that these are some of the changes, but here, you don't have to behave in this manner. You still have to be respectful, right? So once you talk with your children, you be realistic. And for me, just be adolescent friendly. Prepare yourself and just talk to your children.
Are there any specific literature, books, or anything that you would recommend in terms of like reading up and getting more knowledge on the change? I can't remember. I can't remember the name of the book offhand, but I remember when I was in school, the guidance counselor shared out some booklets on what we should expect in terms of our bodies and the physical change, and somehow how to groom ourselves and so on. But I don't know if that's still happening now. Could you say what are some of those things that we can or persons can get to learn more about?
So there are a lot of resources out there. At the Adolescent Health Department, we have resources available to the public at our health facilities, and I will talk a bit more later about what is happening at the health facilities. We have information there also. If you visit the World Health Organization, WHO or POW organization, there's a lot of resources on there that will help you as parents and also guardians to talk with your children when it comes to their health. There's two books that we usually use at our department is Adolescent Girls and Boys, and those two books, like you would have said, teaches you about the changes that you will go through, what you can do when you're going through these changes, how to talk with your child as a parent, and it's also youth friendly or adolescent friendly. So a young person can pick up that book and read it to know what are some of the changes I will go through as a young person. In addition to that, once you work with the schools that your children are going to, there is the program that is called Health and Family Life Education that is being done by the Ministry of Education. It's a very comprehensive program, and it speaks not only about health issues, but also about social issues that are affecting our adolescent population. And that program is done in Form 1 all the way up until Form 5. So you could speak with that teacher that is doing the HFLE program to also get resources, and even look at that manual that they use within that program to get some information and tips on how to work with your children. In addition to that, the Ministry of Health, we have our secondary school program or our school health program, and through that you work with the teachers also to get resources. So resources are available. I don't usually tell people just go and Google for information. If you're going to use the internet, ensure that you get information from credible sources like World Health Organization, CDC, UNICEF, United Nations Population Fund. And I'm going to direct presence back again to UNICEF, because UNICEF is an organization that deals a lot with children and adolescents. So they have a lot of publications and information when it comes to any health issues affecting young people.
Okay. All right, we'll just go to a quick break, and when we come back, we'll hear more To Kaieteur Radio, and this is your Health Matters. We are talking about adolescent health with the National Adolescent Health Coordinator, Miss Salanda Glenn.
Yes.
And she is telling us, she's informed, giving us some information on some of the things that adolescents go through and some of the changes and how we can help them cope. And she was touching, before we left and went to break, she was touching on the programs that are available to specifically deal with adolescents. So, Ms. Glenn, just tell us a little bit more. I understand there are like 5 or 6 programs. There are 5 or 6 programs. Sorry about that. There are 5 or 6 programs. Can you just tell us a little bit more about it?
All right. So through the Adolescent Health Department, Ministry of Health, we look at adolescent health from different avenues. Or components, if you want to say. We look at adolescent health from the community level. We look at adolescent health from the in-school level through our school health program, and also from that level at our health facilities. Mm-hmm. So at our health facilities, we would have started to reestablish what we are calling adolescent-friendly services. Mm-hmm. And now this initiative was previously called youth-friendly services. So a lot of persons that in certain communities are aware of youth-friendly services. Mm-hmm. But because the ministry is moving towards health across the life cycle, we now have a women's health department and men's health department. We are now focusing primarily on the ages 10 to 19, and we would have rebranded. So it is now adolescent-friendly services, and these services are executed at our health facilities. And under that umbrella, we have 3 initiatives. We have our adolescent health and wellness clinics, and our adolescent health and wellness clinics are basically clinics that are set up at our health facilities that are adolescent friendly. What we are encouraging our parents and our adolescents to do is start accessing health services at an earlier age rather than later. And in my introduction, I would have indicated that once we focus on adolescent health, we will be able to do early identification, prevention, and treatment of health issues that affect our young people. So through that adolescent health clinic, we're able to do this, or that's what we're striving to do. We want to see more young people going to the health center and asking their healthcare workers for a diabetes test or a sugar a blood pressure test, or to check their eyes, to check their heart rate, right? To check to see if they're underweight or if they're overweight. And once they go and get these holistic health checkups, we will be able to detect all of the health complications earlier. We will be able to help manage health complications. We will be able to start treatment at an early age. A lot of time what we would find is that when a person is about age 40 or even 50, then is when they will know that, they have diabetes. So once you go to our adolescent health clinics, you will be able to identify it earlier and treat it earlier.
Yeah.
At the health center, we also have our adolescent antenatal clinics, and our adolescent antenatal clinics was an initiative that was started in 2014 on the previous director of the unit, Dr. Artenisa Hamilton, and this initiative was started as as a platform to help us to reduce second and third pregnancy in our adolescents. Our adolescent girls, when they become pregnant, they are already considered high risk. So we wanted a more friendly environment for them to be when they go to clinics, so that they will be able to get the right information, so that they will be able to get detailed health checks. Not to say that when they're an adult, you don't get a detailed check, but we want more emphasis to be placed on our adolescent girls. So that is being done. What we're doing at health centers, we're actually separating the adolescent girls from the older women. So they have a separate time to go to the health center to receive their antenatal and postnatal care. In addition to that, to support the antenatal clinic, we have our adolescent community parenting support group. And these support groups are held throughout the country for young mothers at various health centers. And no, we're not promoting adolescent pregnancy. As I mentioned before, what we're trying to do is to reduce second and third pregnancy. And also at these support group, we speak a lot about parenting and how to prepare our adolescent girls to become mothers, because being a mother at age 16 or 15 or 14 is something very difficult, especially if you don't know how to manage, if you don't know how to look after a child. I usually use the example sometimes that you might even ask a 17-year-old girl how to fold a napkin, and she might not be able to do that because you didn't have that experience. So as our support group, we basically provide support for our girls. We teach them how to fold napkins. We teach them how to prepare food for their babies. What are the things you need to do as a mother? And most importantly, we speak a lot about family planning and contraceptives. We speak a lot about spacing your pregnancy, about using contraceptives to delay a second and a third pregnancy. So that is being done at our health facilities. To date, we have over 32 health facilities that offer adolescent health initiatives. And as of yesterday and currently today, we're also continuing those training in Region 9. As you mentioned earlier, I would have just gotten off a plane from Letem. So we would have done trainings over the last week in Charlton in Central Letem. And today the team, unfortunately, I'm not able to go with them, but they're heading to Anai to work with Anai health centers and other health facilities around Anai to establish those adolescent health initiatives at the health center. In addition to what is happening at our health facilities, we have our school health program. Through our school health program, we go into the school setting and we work with our young people. We establish secondary school health clubs. We are establishing school health hubs, which is a particular room that's in your school to help you to go and have that friendly and safe environment to talk with a counselor, to talk with a teacher, and even to do those HFLE programs. We are also working at our community level where we're training peer educators. One of the biggest view of the adolescent health department is that for us to create change, we have to use people that look like the people that we're working with. So we use young people, we train peer educators, we give them the information, we give them the skills, and then they go back and they work with other young people like themselves.
It's a strategy today for just let them feel more comfortable talking
Correct.
to their peers and so on. So it kind of breaks down the barrier of, oh, you don't know what I'm going through. So
Yes. And it also breaks down the barrier, you old. Which old woman gonna come and be telling me about these things? As much as the old people have the knowledge, they, like you were saying, they feel more comfortable talking with somebody their age.
Yeah.
Right? So those are the initiatives that we have at the Adolescent Health Unit, and these are the way that we're working to tackle adolescent health issues and to improve health and well-being among our adolescent population.
All right. You mentioned you are as the National Health Coordinator for Adolescent Health. What exactly? I know you're quite busy. You travel a lot and so on across the country. What exactly is your role in all of this?
Well, my role is to guide an amazing team that I'm working with. I'm not doing this work by myself, and it will be very awful of me to take all of the credit.
Yeah.
I have an amazing team, and my team, they're also comprised of young people. We have our health education officer. We have our mental health specialist, Miss Setan Small. We have our adolescent health field officer, Miss Fonda King. And we have Miss Graves Andy, who's our health education officer. Nurse Davis and Miss Wendy C. Prasad, who are both our adolescent clinic officers. So my role is to guide the staff in terms of planning the programs and implementing the programs. Because I have the institutional knowledge, I also do a lot of facilitation and training of our healthcare workers. I also am the person responsible for directly working with our donor agencies to plan activities, looking over the budgets that we have, the funding that we have to implement our programs. I am responsible for developing an in-depth work plan for the ministry, the Adolescent Health Department, and I'm also responsible for looking at any policies or strategies that we have to review or to guide, whether it's national policies or international policies. And I would have mentioned also going into the field, also working with our young people, doing presentations in the schools. Before I would have became the adolescent health coordinator, I was a staff in the department. So that is what I'm accustomed doing. So I love going into the schools. I love interacting directly with our young people. I love sharing and I love facilitating. So that's a nutshell in terms of what I do.
All right. in terms of the policy mentioned, you touched on policy. Can you tell us what's the status of our policy as it relates to adolescent health?
All right. So our last policy, our last published document that we would have had when it comes to adolescent health is our adolescent health strategy, and that was done in 2009. Now, the Ministry of Health Adolescent Health Department, with support from our partners, PAO, WHO, United Nations Population Fund, and UNICEF, in 2018, would have started the process of revising that policy that strategy document that we have. What we would have done in 2018, 2019 was to do a situation analysis on adolescent health in Guyana. And that situation analysis is the groundwork preparing us to get an effective policy. So that situation analysis was able to provide data and information on health in general when it comes to our young people. It provided a lot of stats on adolescent pregnancy, on drugs and substance misuse, mental health, chronic disease issues that are affecting our popular young people. So now the next step is for us to start or finalize the strategy. So far the document is in draft, so it has to be revised, and then it will be published and made aware to the public. In addition to that strategy, also in 2019, this was started prior to 2019, but in 2019, with support from the United Nations Population Fund, we would have launched, and this document was also tabled in Parliament, our sexual reproductive health policy. So this policy paves the way for our adolescents and young people to access reproductive health services at our health facility. And why I say access is because most of the time, sometimes when young persons would have gone to access reproductive health services, there were certain restrictions. For example, you could not have been age 16 and get certain things done at the health center. But now with this policy, it paves that way. It gives adolescents the opportunity to go to the health facility and access certain services. Right? So that is one policy that we're very proud of, that we're able to work with our healthcare workers to make the changes at their health facilities, and also to work with our adolescents.
All right, we'll just take a quick break, and then when we come back, we'll have some more questions. Thank you for staying with us here on Kaieteur Radio. You're listening to Your Health Matters, and I'm your host, Rihanna Ramsey. We have with us Ms. Salanda Glenn, and she is the National Coordinator for Adolescent Health at the Ministry of Health, and she's talking to us about that area. And we spoke about a number of issues that are affecting adolescents and the services offered by the ministry, through the ministry and their donor organization stakeholders. But we wanted to specifically talk about some of the actual issues affecting these young people, like, for instance, sexually transmitted diseases, teen pregnancies, substance abuse, some of the issues like dropping out of school early school leavers. How is the ministry through the unit tackling these issues with our young people?
All right, so we're tackling those issues mainly through the initiatives that I would have identified. So when it comes to our school health program, because we see that school health program as that vehicle of change, we have in-school sessions that is usually being done with our young people. It is not the HFLE program, but it's different, but we also support the Ministry of Education on their HFLE program. So every week we will go into the schools and we will usually have sessions on various topics on STI prevention and HIV, on substance misuse, mental health, nutrition. All of the topics that affect young people, we literally have discussions on them at our school setting. But due to COVID-19 and the discontinuation of schools, we weren't able to physically go into those classrooms. So what we would have done, we would have moved towards that virtual platform. So over the last couple of months, we would have had virtual sessions with various secondary schools and primary schools across Guyana, where we're educating our adolescent population and providing them with the information. In addition to that, our peer educators, we have a program that is called Adolescent Health that we GAF, and this program is being aired every Friday at 6 o'clock on our Facebook page at Adolescent Health. So through that program, we also disseminate information. We answer questions that our young people will have. We have another initiative that is called Youth Seeking Answers, and through that initiative, adolescents have the opportunity to text our number 699-2286, and we're able to answer their questions directly on any issues that they're going through. In addition to that, because we're equipping our health centers to conduct our adolescent health initiatives, our healthcare workers are able to share information and provide services. So if an adolescent will come into the health center and say, I'm thinking I might have a STI, they will speak with that young person. They could provide treatment and counseling. Yes.
Mental health is a big topic, but we often ignore it because, I don't know, our cultural makeup. When somebody says they want therapy, we look at them funny and all kind of thing. How is that? What type of service is available to young people so that they can feel comfortable talking about issues affecting their mental health?
Okay, so from the adolescent health department standpoint, because we are prevention, sometimes we don't directly provide counseling to our young people on mental health, but we work very closely with our mental health department of the Ministry of Health, and through them, we do a lot of awareness session. And once you would have recognized that a child or adolescent is being affected by mental issue, they're directly referred to the mental health unit for counseling. The mental health unit, they have a lot of social workers, they have psychologists, they have mental health assistants that are trained to provide counseling and psychosocial support to our adolescents and young people. For us at the department, we do a lot of awareness sessions. So we will have our show that is targeting adolescents that talks about mental health. We will talk about how to cope with your mental health difficulties that you're experiencing. But once we know that once you're suffering from a mental issue, I don't like the word suffering, but living or experiencing a mental issue, we will directly send you to the mental department for counseling. In addition to the mental department, there are services that are offered through the Georgetown Public Hospital Corporation, which is a department or a program of the Ministry of Health. We have at the GPHC, we have 2 child and adolescent psychiatrists that are operating there, and we also have social workers and counselors that are able to provide counseling and psychosocial support to our young people. For us at the school level, what we do, we usually train our teachers in a program that is called CBT, Cognitive Behavioral for Trauma in School Youths. And through that program, our teachers are able to recognize when a child or adolescent is experiencing or affected by a mental health issue. And I know also that the mental health unit, they're training our doctors, they're training our nurses, and also they're training our teachers.
You mentioned how COVID-19 affected the services you offer, especially going to the schools. In terms of your interaction with these young persons, what is the feeling, what's the feedback you've got, you've received so far in terms of how COVID-19 in general, the pandemic is affecting them? How do they, what do you have to say? What do they have to say about it in terms of how they, Well,
COVID-19 has significantly affected everybody's life, and most of the times, sometimes as adults, we think it don't affect our children or young people, but it does. Earlier in the year, we would have done a situation analysis on COVID-19 with our young people, and this was supported by UNICEF. And some of the things that we heard from our young people is, one, that they're very fearful. They're scared because it's something new. This is the first time they're living through a pandemic. At the beginning, they did not know how to cope and what to expect out of this pandemic. So they were very fearful. A lot of our young people reported that they would have seen an increase in their anxiety level. They would have seen an increase in how they're feeling depressed, because remember, when COVID started, everybody was forced to isolate. Yes, we had to isolate for our protection, but it was forced. We weren't accustomed to not being outside, not playing with their peers, not doing certain things. So when that isolation period hit, they became depressed, right? Young people reported that they feel a sense of loss, a sense of hopelessness. A lot of young people spoke about not knowing what their future will bring, because their schooling was closed, their academic life was interrupted. Some persons had the vision or the dream or goal of graduating a particular time, and that had to be shifted back. So in terms of their entire career path, their professional lives, those are some of the things that they would have reported that was affected. But most importantly, they spoke a lot about their mental health. So I'm happy that you asked the question about what we were doing, and as a result of that, we would have started to work on programs to improve our children and adolescent mental health.
In terms of people who want to know more about, because you mentioned some numbers and so on earlier about the unit, the work you do, if they have questions, they want to follow up on what we discussed here today, where can they go to get those questions answered?
All right, so you can, for the Adolescent Health Unit, you could call us on 223-5310. That is our office number. You can visit us on Facebook at Adolescent Health Program. We also have our School Health Club program on Facebook, our page, so you can visit those two pages. You can message our Youth Seeking Answers number, 699-2286. That is 699-2286. When it comes to any issues, for example, with your mental health, the mental health unit would have launched a safe space hotline. And just let me get that number for you. So if you have any questions or anything to do with your mental health, you could call 655-7233. And that number, you could also access it via WhatsApp and send your questions. Once you call that number, you will speak to a professional psychologist or a social worker from the mental health unit.
And just to add to what Ms. Glenn just said, there's nothing wrong with speaking to somebody. It's natural. Conversation therapy is important, especially now that we're going through so much.
Yes.
With COVID-19, it's affecting our economics, our finances, different things. So it's okay. You can call and you can speak with somebody, and the services are free.
Yes.
I would. It's free, so you can call and get those services, access those services. So I'm just grateful that Ms. Glenn is here today. She came off from a flight straight from Latam, and she came straight to the studio, and that shows the level of commitment that she's she has to her job and to the young people who she serves. And we just want to thank you for coming here in studio with us and sharing with us. For those who listen, thank you for joining us. On behalf of the Kaieteur Radio team, we just want to say that let's stay safe and stay within the COVID-19 guidelines.
Correct.
Until you join us again here for another edition of Your Health Matters.
Yes.